Hi everyone. So welcome to Monday Reading Live. My name is Vandana PS, one of the reading trainers from 𝐻𝐿𝐬𝐬𝐬𝐻𝐿𝐬𝐬𝐬𝐬𝐻𝐿 So how was your weekend? Did you all do additional materials? All right. So let me please check how many of you have joined this live segment. All right. Yes, good afternoon once again. So as usual, let's start with a sample question from part B, and for that I'll give you 2 minutes for the preparation. So here comes the question. Welcome back. So did you all do this question, 𝐬𝐻𝐿? Okay, yes, Roshna, Midun, Sharanya, Jisa, good afternoon, guys. Okay, so let me know your answer, please, in the comment box. നിങ്ങൾക്ക് എന്താ ആൻസർ കിട്ടിയെന്നൊന്ന് കമൻറ്റ് ചെയ്യാമോ? Okay, I'll read the question, then we will discuss the answer, okay? The extract informs us that the change in prescription is due to, a little bit confusing question, I know, and yeah, so what is important here? We need to understand and we need to focus on the keywords from the question. So my keywords from the question, which are informs, then change, then prescription. Okay, so these are my keywords from the question, and as you know, already I've mentioned in the previous classes, when you underline keywords, it should be not more than 3 individual words. 3 individual words il koodal nammal mark cheyirudhu. If you guys are doing so, it will be very confusing for you. So it's very easy to underline 3 individual keywords from the question. Okay, that will help you to find out the correct answer. Clear? Then when you read a question, always connect with your option. Okay, so this is an incomplete question, so first of all I'm connecting my question with option A. Okay, yes, option A new invention of an application that improved patient care. So what are the keywords from option A? Question la nammal keywords mark cheyna pole thanne important aanu. You have to underline keywords also from the options, right? So what are the keywords? Option A, invention, application, improved. Okay, and option B, method, cost effective, hospitals, and option C, horizon, heighten, then efficacy. So these are my keywords from these 3 options, and it almost look like the same. ശരിയല്ലേ? സോ ഇത് 3 വായിക്കുമ്പോഴും ഏകദേശം ഒരേപോലെ തന്നെയാണ് ഇരിക്കുന്നത്, ബട്ട് സ്റ്റിൽ ദർ ആർ ഡിഫറൻസസ്. ഓക്കെ, ആൻഡ് ലെറ്റ്സ് ഫൈൻഡ് ഔട്ട് വാട്ട് ഇസ് ദ കറക്റ്റ് ആൻസർ ഫോർ ദിസ് ക്വസ്റ്റ്യൻ. സോ ഐ റീഡ് ദ പാരഗ്രാഫ്. സോ ബിഫോർ ദാറ്റ് നിങ്ങൾക്ക് എന്തെങ്കിലും ഐഡിയ ഉണ്ടോ? എനി ഐഡിയ ദാറ്റ് വിച്ച് വൺ ഇസ് ദ കറക്റ്റ് ആൻസർ? Okay, so I'm reading the paragraph. Electronic prescribing system. So first of all, which category of question is this? And again, there will be a confusion regarding which category, because directly they have not mentioned which category. Either category annulladu directly mentioned alla. So definitely namukku oru confusion varum, idu either category of question aanu. So which category? Either category anennu manasilayo? Okay, so extract informs us that the change in prescription is due to something is changing here, which means the prescription itself is changing, and this extract, which means this information, this document gives you an information all about. Okay, so this is all about an electronic prescribing system. So nammal vicharikum okay, it's a manual, maybe a device avam, so it is a manual. No, of course not. Okay, so this is all about a notice. Okay, so the notice is providing for others to give an information regarding why they have changed something. Toda change vannathu endana, from the normal prescribing pattern they have changed to electronic prescribing system, and what is the reason for the change. Okay, so we can categorize this particular this document into the third category, which is a notice, and what we are reading for? We are reading for the purpose. That means nammal purpose nu venditana vaayikkunnu. That means overall idea of the extract. Okay, so what is the overall idea? So let me read. A case study led by Christy Banfield, Rotham NHS Foundation Trust found that the switch to electronic prescribing supported effective service delivery and robust data protection when the team switched to remote working. So yeah, they've changed to something. However, the team expects the rollout to be a catalyst for further efficiencies and more cost-effective service where patients, pharmacies, dispensing appliance contractors can mitigate delays. Mitigate, which means delete, eliminate delays in receiving the prescription and products. So why they've changed to this? എന്തിനാണ് അവർ ഇങ്ങോട്ടേക്ക് മാറിയത്? For better or further efficiencies and more cost-effective service where patients, pharmacies, dispensing appliance contractors and mitigate delays in receiving the prescription and the products. From that particular line, I will eliminate an option. Which option? The option എനിക്ക് ആ ലൈനിൽ നിന്ന് eliminate ചെയ്യാൻ പറ്റും. Okay, so in part B, what you have to do is read the question, underline the keywords, read the options, underline the keywords. When you read the extract, also along with reading, you can eliminate your answers. Okay, വായിക്കുന്നതിൻ്റെ കൂടെ തന്നെ നിങ്ങൾ elimination കൂടെ ചെയ്യുക. That will be much more better to find out the answers very easily. Okay. Okay, Jissa, yes, your answer is okay. Okay, let's see. But, okay dear, okay, I understood, sorry. Okay, you can eliminate that option, right? I understood. So we can eliminate option B because nothing mentioned about hospitals here. ഇവിടെ ഹോസ്പിറ്റൽസ് എന്ന് പറഞ്ഞിട്ട് ഒന്നും തന്നെ മെൻഷൻഡ് അല്ല. ഇറ്റ്സ് ഓൾ അബൌട്ട് പേഷ്യൻസ്, ഫാർമസീസ്, ഡിസ്പെൻസിങ് അപ്ലയൻസ് കോൺട്രാക്ടേഴ്സ്. ഓക്കെ, സോ ദാറ്റ് യു ക്യാൻ എലിമിനേറ്റ് ഓപ്ഷൻ ബി. ഐ വിൽ സേ നോട്ട് മെൻഷൻഡ് എനിവെയർ ഇൻ ദ പാര. അങ്ങനെ ഒരു കാര്യം ഇവിടെ പറയുന്നില്ല. എന്ത്? ഹോസ്പിറ്റൽസ്. Okay, so we are eliminating this option B. Then I am reading the further lines here. Having piloted the rollout of electronic prescribing at the start of the pandemic, the functionality and its benefit has already been rolled out to other community teams across the trust. The team now are also considering how the functionality can be safely and effectively integrated within health apps to further improve the ordering and coordination of repeat prescription ordering and improve patient care and experience. So from the last lines, and you know that when you read the third category, which lines are important, the lines are important, actually the last lines are important. Okay, I'm not saying that the last lines will be the answer, but most probably you will get a lot of clue from the last lines. Clear? Okay. So with the last line in there, you will get the answer, plus you can eliminate an option. The option namke eliminate here. And what is the correct answer? Please let me know in the comment box. Namukku idinne the option eliminate here, plus which option is the correct answer? The option nammal eliminate here. What is the reason for eliminating that particular option? I mean, remaining options, which is option A and option C, and one option for sure you have to eliminate. Right? Yeah. So which option you guys will eliminate, and what is the correct answer? എന്തായിരിക്കും? Okay, Jissa, you can eliminate option B. Yes, Roshna, നമ്മൾ option B already eliminate ചെയ്തു because it is not mentioned anywhere in the para. Very good, yes. And what about the remaining options, option A and option C? A new invention. Option A is like a new invention of an application that improved patient care. Okay, same like option A. There is I can say a slight difference. Okay, when you connect with option C, a new horizon to heightened efficacy in rendering service. Yes. So how can we eliminate option A? Okay, Roshna, your answer is option C, right dear? Okay. So why you eliminated option A? Let me know. എന്തുകൊണ്ട് ഓപ്ഷൻ എ എലിമിനേറ്റ് ചെയ്തു? ഓപ്ഷൻ സി ആണ് ആൻസർ എങ്കിൽ എന്തുകൊണ്ട് ഓപ്ഷൻ എ നമ്മൾ എലിമിനേറ്റ് ചെയ്യുന്നു? Okay, if your answer is option C, then why you guys are eliminating option A? So please let me know in the comment box. Okay, Lini, A is the answer, right? Okay, dear. Okay, then why you are eliminating option C? എന്തുകൊണ്ട് അപ്പോൾ option C eliminate ചെയ്തത്? See? And one more clue I'll say. Okay, I can give you an information regarding part B. If suppose any direct line is mentioned from the paragraph into the answer options, 95% I can say, yeah, most probably I can say, it will not be the correct answer. Because part B and part C is all about paraphrasing. Okay, part B and part C എന്ന് പറഞ്ഞ ഒരിക്കലും direct answers തരില്ല. They will not give you the direct answers. Instead of that, they will give you the paraphrased form of the answer, right? Okay, that means that same meaning will be there, but entirely different sentence structure. All right. So here, option A is actually a new invention of application that improved patient care, and something is mentioned in the paragraph regarding improvement or efficacy. But what is the difference? So OET is already a language exam, so please be focused into the language rather than your profession. Okay, so what is mentioned here? Improved patient care. So what is the meaning of improved patient care? Already passed. Okay, improve ചെയ്തു എന്നുള്ള മീനിങ് അല്ലേ? ബട്ട് വാട്ട് ഇസ് ഇൻ ദിസ് പാരഗ്രാഫ് മെൻഷൻ? പാരഗ്രാഫിൽ എന്താ പറയുന്നത്? പാരഗ്രാഫിൽ വെരി ക്ലിയർലി മെൻഷൻ ദാറ്റ് ദ ടീം നൗ ആർ ഓൾസോ കൺസിഡറിങ്, ദാറ്റ് മീൻസ് പ്രസൻറ്റ് ടെൻസ്, പ്രസൻറ്റ് കണ്ടിന്യൂസ് ടെൻസ്, ഇപ്പം നടന്നുകൊണ്ടിരിക്കുന്ന കാര്യമാണ്. Okay, so now they are considering how the functionality can be safely and effectively integrated within the health apps to further improve the ordering and coordination of repeat prescription ordering and improve patient care and experience. So they are trying to improve everything through this changed method. മനസ്സിലായോ? Okay, so അവർ improve ചെയ്യാൻ നോക്കുന്നേ ഉള്ളൂ. It is a current procedure, not a past thing. So that you can eliminate option A because, yeah, of course, it is contradictory or opposite option, right? Yeah. Yes, so that you can eliminate option A because it is opposite option or contradictory option, right? Answer is option C. Same line, last lines. A new horizon, which means a new method, a new approach. Okay, horizon here, which means a new method or a new approach. To heighten, which means not that height, it is improving. Okay, efficacy, which means the efficiency in rendering service. So answer is option C. That is the purpose of this notice. I hope it is clear. Yes. Okay, any doubts? Yes, Jisa, improve. Yes, improve, it is contradiction. Yes. Okay, so C is the correct answer. A is contradictory. Very good, Jisa. Yes. Okay, so now we are moving to the most important part, which is, okay, so which is part A, demyelinating disease. Okay, how is the material? Here the system is not new. Actually, there is no connection with the system is nothing not new or past, I mean old. Okay, we are always connecting with what? The language, not with these kind of, the system is nothing not new or old. It is all about the language difference. Okay, in option A, the language is different because it is already done. That is what mentioned in option A. But in the paragraph, it is all about present things. Okay, so when you read paragraphs in this exam, it should be connected with your language, not with any other things. Okay. Yes, Papadi, hi, good afternoon, dear. Okay, so have you done this material? Okay, so demyelinating disease. So I'm going to the first question. I hope you guys have underlined and read all these paragraphs before doing this question answers. So the first question, common indicators of demyelinating disease. So my keywords, common indicators, only two keywords which I'm underlining. Okay, okay, very good, yes. Okay, Jisa, so what about the first question there? What is your answer? Common indicators of demyelinating disease, and I know that this was a very simple material, okay, because this is Monday. So yeah, as usual, very simple material. Okay, yes, so answer is correct, Papadi. Yes, dear, answer is from B. Okay, which is from text B. And why? See, text B is all about signs and symptoms. So if you have already underlined the keywords from the question, I am sure that you guys, your answer will be text B. So signs and symptoms. Okay, a lot of signs and symptoms mentioned here. So that common indicators which are synonyms for the word signs and symptoms. So answer is B. Okay, yes. Okay, Papadi, Roshna, Jissa, Anu, very good, very good. Answer is B. Second one. How is someone's eyesight affected by demyelinating disease? Enginean eyesight affecting the. Okay, so my only keyword is eyesight affected. Yeah, so these are my keywords from second question. I'm not marking any three words, which I found it very important. That is eyesight and affect. Okay. So what about second question? Again, eyesight affection. Yeah, affected, not affection. Affected, which means one of the symptoms, right? So yeah, again symptoms mentioned in text B. So without even reading the text, you can find out answer is from B. Okay, again, yes, Papadi, yes, Bala, Jissa, Roshna, Nelsi, Divi, yes, very good, very good. It's again from B. So two answers from text B. Third one, what is the purpose of myelin sheath? Okay, so what is this myelin sheath and what is it mentioned about the purpose of the myelin sheath? Okay. So all about this disease condition, what is a myelin sheath? So what is it? It is mentioned in any idea? In which text they have mentioned about the purpose of myelin sheath? So my keywords, purpose, then myelin sheath. Yeah. Okay. Okay, Nelsie, third one, it's not from text C, dear. It's from text A. Okay, it's okay. Actually, answer is text A, which is the direct answer from text A. See the second line. First para, second line. Myelin is a protective cover, that means a sheath. The sheath is a cover. So that means a protective sheath around the body section of nerve cells in your central and peripheral nervous system. Then myelin strengthens. Okay, so what is the purpose of it? It strengthens, protects and insulates your nerve cells and allows electrical impulses to travel between cells. Okay, so that means answer is from A. Okay, it's okay dear, I understood. Maybe a typo, like, okay. Yes, so Nelsie, yes, Divi, no, okay, it's from text A. And what about question number 4? Number of cases included in the quantitative analysis. Okay, so my keywords, number, cases, and quantitative analysis. So whenever you see this kind of words analysis, you can connect with research, okay? And study, research, analysis, evaluation, examination, okay? So that means, what analysis I mentioned cheyidekkunne. So where they've mentioned about a number of cases, included, excluded, quantitative analysis. So of course we have two diagrams, not diagrams here, pictorials here, text C and text D. And in text D it's all about the study. Okay, analysis aanu. Yeah, that means, where is it mentioned? Quantitative analysis. Okay, yes, Divi, Jisa, Nelsie, Roshna, Papati, yes, Anu. Very good, very good. Answer is from text D. See the last box, a small box. So whenever you guys are seeing this kind of small boxes in any of the text, please mark it very clearly. Definitely they will ask you a lot of questions from these kind of text. Okay, I mean these kind of boxes. So answer is quantitative analysis from, yeah, text D. Okay, so answer is D. Okay, then fifth one. When shall one have to continue with the pulse therapy for 7 more days? Okay, so my keywords, continue, then pulse therapy. Actually, pulse therapy is not a single word. No, not a combination of words. Single word. Okay, 7. Okay, so what about that one? When shall one have to continue with the pulse therapy for 7 more days? Okay? Okay, so fifth one, your answer is C, right? Okay, Roshna, yes, Papadi, Anu, Jisa, Divi, Nelsie. Very good. So answer is C, which is from C. So why? Why it is C? 7 more days. Number of days mentioned. Okay? So pulse therapy, where is pulse therapy mentioned? Yeah, here. Pulse therapy, 5 days plus Plex, P-L-E-X. Again here pulse therapy, 5 days. Okay. Then pulse therapy, 7 days. So actually, yeah, here is our answer. Okay. It's from text C. So something has happened in between. I have no idea. Yeah. So this one. Okay. So answer will be from C. Very good. Correct answer. Sixth one. Which are the contributing factors of demyelinating disease? So my keywords, contributing factors. Okay. Yes. Sixth one, okay, text A. Any other answers, anyone? Is it text A? Is it text B? Okay, it is text A. Very good. So answer is A. And contributing factors. See, a demyelinating disease can happen due to multiple factors which can include. So the contributing factors or the multiple factors which is mentioned in A. Okay, so answer is A. And the final question from the first category of questions. So how do we manage the symptoms in the case of its remission? Sorry, not remission, remission. So my keywords, manage, symptoms, remission. Okay, yeah, from this, don't ever think that already they've managed about the symptoms here. So answer is from text B. Is it from text B? Is it from text B? Okay, yes. So seventh question, which is from text C. Why? Okay, symptoms കാണുമ്പോൾ നമ്മൾ വിചാരിക്കും text B ആണ് because yeah, signs and symptoms mentioned there, but no. Okay, so how to manage the symptoms, how to manage the disease condition which is mentioned in text C with a lot of methods, measures, so that I can say, okay, first one, it's all about the explanation of the disease condition. Okay, explanation. Second text is all about symptoms. Okay, and third, text C, it's all about the measures, or I can say management. Okay, and text D, it's all about the study. So this is how we are analyzing a particular material. For example, part A, when you are reading it, നമ്മളത് വായിക്കുമ്പം ഇങ്ങനെ വേണം അനലൈസ് ചെയ്യാൻ. ഓക്കെ, യു ക്യാൻ ജസ്റ്റ് സ്പീഡ് റീഡ് ദ ടെക്സ്റ്റ്, പെട്ടെന്ന് തന്നെ വായിക്കുക. പ്ലസ് യു ക്യാൻ അണ്ടർലൈൻ സർട്ടൻ കീവേഡ്സ് ഫ്രം ദ ടെക്സ്റ്റ്. പ്ലസ് യു ഷുഡ് അണ്ടർസ്റ്റാൻഡ്, ഓക്കെ, സോ വാട്ട് ഇസ് ടെക്സ്റ്റ് A is all about. Then what is text B is all about. Text C and text D. Okay, then, so it's done. Then 8 to 14, so I'm jumping to the next one. How long should we continue the pulse therapy in the initial phase of treatment? So my keywords, how long. Okay, if it is how long, that means the duration they are asking about. എത്ര നേരമാണ്. Okay, how long, duration. Continue, I'm not marking continue. Pulse therapy, I'm marking. Then I'm marking initial. Okay, so these are my keywords from the question. So how long, definitely when they ask about how long, it will be a time or year or number of days. ഒന്നില്ലെങ്കിൽ സമയമായിരിക്കും, അല്ലെങ്കിൽ ഇയേഴ്സ് ആയിരിക്കും, അല്ലെങ്കിൽ നമ്പർ ഓഫ് ഡേയ്സ് ആയിരിക്കും. ഇറ്റ് ഈസ് ഫോർ ഷുവർ. ഓക്കെ, ഹൗ ലോങ്, വെൻ ദ ക്വസ്റ്റൻ ഇസ് സ്റ്റാർട്ടിംഗ് വിത്ത് ഹൗ ലോങ്, സോ പ്ലീസ് ബി നോട്ട് ദാറ്റ് either it will be time, ഒന്നല്ലെങ്കിൽ സമയമായിരിക്കും for 15 minutes, 10 minutes, or it will be what, year or number of days, months ഒക്കെ ആയിരിക്കും കേട്ടോ. Okay, so what about this one? Hi Delighta, good afternoon dear. What about 8th question guys? What is your answer? How long should we continue? How long? എത്ര നാൾ കണ്ടിന്യൂ ചെയ്യണം എന്നാണ് പറയുന്നത്? How long we should continue pulse therapy in the initial phase of treatment. So initial phase, which means the starting phase of the treatment. Very good Divi, your answer is perfect. Okay, obviously it is 5. Yeah, 5 days. Okay, and where is it mentioned? They mentioned 5 days. Yeah, so here pulse therapy in the initial phase, initial treatment, you can go for 5 days. Okay, so that is the duration of the session. Okay, 9th one, kind of infections responsible for the development of demyelinating disease. So my keywords, kind, infections, development. What about 9th one guys? Okay, Rose, yes. Linu, Anu, Ginny, Roshna, Nelsie, yes, it's 5 days. Very good, very good. 9th one, what about 9th one? Kind of infections responsible for what infections? Say the infections are kind of infections responsible for the development of demyelinating disease. So what are the infections? Kind of infections, which means they need to know the infections. Which are the infections? Okay, very good. So answer is viral or bacterial. Okay, and it is mentioned here. And where is it mentioned? See, one of the factors. Okay, viral or bacterial infection. So you don't have to write that infection again there. For example, you don't have to write a viral or bacterial infection. Instead of that, you guys can write a viral or bacterial. That is the correct answer. Why? And then already infections mentioned in the question, so you don't have to repeat any single word from the question into the answer option. That was the reason. Okay, so answer will be what? A viral or bacterial. Okay, yes, very good Jissa. Answer is from text A, one of the factors. Then 10th one, which is the most frequent form of demyelinating diseases? So my keywords, most frequent, which means common, typical. Okay, form. Yeah, So these are my keywords from the question. So any idea? 10th one. Most common form. ഏതാണ് most common form? Okay, Nelsie. Once again, you got the correct answer, dear. Excellent. Okay. Answer is multiple sclerosis from text A. Okay, it will be multiple sclerosis from text A. So where is it mentioned? See, multiple sclerosis is one of the most common demyelinating diseases. So one of the most common, that means most frequent condition. Okay, answer is multiple sclerosis. Very good. Answer is multiple sclerosis. So when you guys do short answer questions, always answer to the question. നമുക്ക് എപ്പോഴും ഒരു ടെൻഡൻസി ഉണ്ട്. You guys have this tendency that you have to add additional sentences there. അങ്ങനെയാണ് നമ്മൾ വിചാരിക്കും. But no, you don't have to add any single word into the answer option. Okay, and it should be maximum 2 to 3 words. 2 or 3 words മതി. Okay, so when I say 2 or 3 words, a word itself is a word. ഇവിടെ word എന്ന് പറയുന്നത് തന്നെ ഒരു word ആണ്. Okay, so word which means a single combination of different alphabets അല്ലേ. So a single word and 2 to 3 എന്ന് പറയുമ്പോഴത്തേക്ക് maximum 3 wordsൽ നിൽക്കണം. If you are writing more than 3 words, it will be wrong. Okay, അത് തെറ്റാണെന്നല്ല ഞാൻ പറയുന്നത്. Definitely they will strike it off. Okay, so answer will be multiple sclerosis from text A. So first one which was from text C, second one A, third one also from text A. Okay, Linu, yes, Divi, Joshna, Anu, Nelsie, multiple sclerosis. Very good. And 11th one, how many replicate cases got removed from the study? Replicate, what is replication, which means? You can replicate this theory into the human studies. Copy cheya, apply cheya, same thanne. Okay, so replicate, which means copy the same. So how many replicate cases? Okay, so my keywords, how many എന്ന് പറഞ്ഞാൽ എന്താ? എത്ര. That means they need a number there. Just write the number. Okay, don't write this much number. അല്ലെങ്കിൽ ഇപ്പം 70 ആണെങ്കിൽ 70 cases. Don't write or don't repeat it. Okay, so answer will be here, it's 174. 174 cases. Okay, 174. How many replicate cases got removed from the study? So answer is 174. And where is it mentioned? Okay, Ginny. Okay, dear, why does vision changes? I didn't get that. അതെനിക്ക് മനസ്സിലായില്ല. Which question? 9th one ആണോ അല്ലെങ്കിൽ 10th one ആണോ? Vision changes? No, it's not vision changes. It is multiple sclerosis or not. 11th one is actually 174. Okay, so yeah, it's mentioned in text D. Okay, so what about 174 cases? Records after duplicates removed, 174. Okay, so answer will be from text D. So 174 cases removed. So my answer is 174 from text D. Okay, so are you guys able to see this screen? No? Okay, so please let me reconnect. Screen കാണുന്നുണ്ടോ? Is it visible? Okay, yes. So 12th one, where can we notice MS hug or a squeezing sensation following demyelinating diseases? So my keywords, yeah, it is a very lengthy question. Where, which means they need to understand which place, എവിടെയാണ്. Okay, which area, എങ്ങോട്ടല്ലേ, എവിടെയാണെന്നുള്ളത്. Where can we notice MS hug or squeezing sensation following demyelinating diseases? So my keywords, where, then MS hug and squeezing. Okay, so these are my keywords. Yes. Okay, why does United States there? Okay, it's okay. So where, which means എവിടെയാണ്. Actually answer is chest or abdomen. Okay, which is from text B. Okay, and where is the answer? Answer is from text B. Around the chest or abdomen. Okay, Divi, if you're writing around, the chest or abdomen. How many words? 5 words. Okay, so definitely they will strike it off. So it should be maximum 3. Get out. So, engane edutha namukku answer? MS, hug or squeezing sensation, those are the keywords from the question. And you can cut the word around. Avade around namukku venda. Okay, so you can write there your chest or abdomen. So, yorum namukku cut cheyam. So, answer is chest or abdomen. Okay, Sharikim, the answer is around your chest or abdomen. That is the complete answer, I know, and you guys know that. But let's cut off the words around as well as your. So, answer will be chest or abdomen. 3 words. Okay, so answer will be 3 words. Okay. Okay, dear. Yes, yes. Okay, Roshna, I understood. Okay, then 13th one. The inclusion of which medication is needed in the pulse therapy if the patient has no remission of symptoms during re-evaluation? Okay. So what is the correct answer? Again, a very lengthier question. So my keywords: inclusion, medication. You need to understand which medicine. Okay, either medicine or none. So inclusion, medication, and remission, right? Yeah. Okay. So what about that? Which medicine? Inclusion of which medicine? Either medicine now. Okay. So which medicine? Pulse therapy, inclusion, medicine. So I got that answer from here. Okay. See, considering extending pulse therapy and PLEX. So the name of the medicine is PLEX. Answer will be Plex. Okay. No, dear, actually I couldn't see your answers. Yeah, now I can see your message here, your comment here, but I haven't seen your previous answers, dear. Okay? Yes. So please do comment, okay? Yes. So the first one, the answer is PLEX. 14th one, the parts of the body that may experience electrical tingling or shocking due to demyelinating diseases. So keywords: parts, then electrical tingling. Yeah, so these are my keywords. Electrical tingling and shocks. Of course, it is mentioned in text B, maybe one of the symptoms, right? Okay, symptoms adikam. Yeah. So what about the symptoms? Electrical tingling or shocks down your arms or legs when you bend your neck forward. Okay, so answer is arms or legs. Okay, very good. Yes, Jisa, answer is arms or legs. Okay, Divi, answer is arms or legs. Okay, Akku, arms or legs. That is the correct answer. Very good. So that's all with 14 questions. Okay, so now we are moving to 15 to 20. So the first question, the screening of the cases were totally based on the dash and dash. So what and what? Screening cases totally. Okay, screening cases totally. So based on what and what? Endindeka based lana. Okay, so screening, which means total cases. So definitely it is mentioned in text D because all about the study. Okay, the analysis. So I'm sure it's about text D. Very good, I know. It's all about title and abstract. Okay, title, record screen based on the title and abstract. So answer is title, abstract. Already answers in between. So that you can write title, abstract. Then 16th one, the dash mistakenly attacks the myelin sheath or the cells that can make up your myelin. If you have a demyelinating disease. So my keywords: mistakenly, myelin sheath, and myelin. Okay. So what is 16th one? Yes, I know, immune system. So answer is immune system from text A, which is from second para, first line. If you have a demyelinating disease, your immune system mistakenly attacks the myelin sheath. Direct answer. Okay, so which is immune system? Answer is immune system. Yes, Delighta, Divi, it's immune system. Okay. And the 17th one, You will have electrical tingling or shocks down your back, arms or legs when you're bent your dash forward. A same pattern of question from the previous one. Okay, electrical tingling and arms or legs. Okay, so which is, okay, any idea which is the correct answer? Same line, so answer here it is neck, right, which is mentioned in text B. Okay, so answer is neck forward. Your neck forward, answer should be neck on answer. Okay. And 18th one, dash strengthen, protects and insulates your nerve cells and allows electrical impulses to travel between cells. Okay, so dash strengthens. What strengthens? Strengthen, protects and insulates. So what is the correct answer here? Yeah, so that is myelin. Okay, so myelin, which is mentioned in text A. Yes, the first para, actually in the last line. Dash strengthen. What strengthen? Myelin strengthen. Okay, and insulates your cells and allows electrical impulses to travel between cells. So that is the correct answer, which is myelin. And the 19th one, dash of, so there is a small typo, okay, typing error maybe. So PLEX plex or not fix, it is plex. Along with pulse therapy is needed in absence of remission of symptoms while the resolution period. Answer is from text C. Okay, so which is all about resolution, yeah. So what about the answer? It is 7 to 10 sessions. Okay, not days dear, it's not 7 days. Avaru choikkunna plex inde karyalla. So that is 7 to 10 sessions aanu. Okay, if it is about pulse therapy, you can say 7 days. Yeah, of course it is correct, but it is all about plex aanu. So answer should be 7 to 10 sessions aanu. Okay. And the last question, we have to reduce the administration of dash if the patient shows remission of symptoms during the resolution period. Okay, so what is it? 20. Remission, symptoms and the resolution period, answer will be, what is it? 20th one. Okay, I know, very good, correct answer. Yes, Papadi, it's not 7 days dear, 7 to 10 sessions, right? Okay, yeah, so what about the last one, 20, question number 20? Yes, 20th question, oral corticosteroid. Okay, oral corticosteroid, which is mentioned here. Yeah, so that's all about oral corticosteroids. So what was the question? Question in there, no? Administration, remission, symptoms during resolution period. So resolution period, which is the last one. So yeah, oral corticosteroid should be the correct answer. Okay, so I hope it is clear. Any doubts regarding any of the questions here? So please let me know your marks plus the time. And what about the marks? Okay. It was a very easy material, I know that. You guys know that. Okay, yes. So 20 out of 20, dear? Okay. So that's all about today. So please stay tuned. Thank you, dear. Thank you, everyone.